Medicare's costs change every year, and 2021 is no different. Even with the horrible 2020 we had with the pandemic, with all those new changes in healthcare, Medicare still went up as far as its costs. In today's video, I'll go over those costs and what you need to know about Medicare in 2021. Thanks again everybody for watching this video. If you could, subscribe and hit the bell notification so you don't miss any new videos about retirement planning, Medicare investing on my channel. Alright, so in today's video, I just wanted to get Part A, Part B, Part C, Part D, and the Medigap program, as well as new things that were implemented in 2021 done. So we'll first start alphabetically with Part A of Medicare. Now the Part A premium did change for those beneficiaries who haven't worked that 40-quarter or 10-year period in the United States. And most beneficiaries do meet that amount. So if you're wondering if your Part A premium is going to suddenly appear and you never had to pay it before, don't worry. So the premium, for those who do pay, premium costs have gone up for 2021. People who worked for 30 to 39 quarters in their lifetime will pay $259 per month, which is up $7 per month from 2020. And people who work less than 30 quarters in their lifetime will pay $471 per month, and that's up $13 from the 2020 number. Next, Medicare Part A coinsurance and deductibles also went up, so let's take a look at those as well. So the deductible for Part A went up, and this deductible covers an individual benefit period which lasts 60 days from the first day of hospital or care facility admission. The deductible for each benefit period in 2021 is $1,484, which is $76 more than 2020. When care is required for longer than 60 days, the coinsurance cost also applies. For hospitalization, this means that Medicare Part A will charge participants a coinsurance of $371 per day from days 61 through 90. Now this is up from $352 in 2020. Beyond those 90 days, you'll actually have to pay $742 per day for lifetime reserve days, and that's up from $704 in 2020. For admission to skilled nursing facilities, the daily coinsurance for days 21 through 100 is $185.50 per day, and that's up from $176 in 2020. A new benefit period begins once you have been out of the hospital or nursing home care for 60 consecutive days. At that point, the deductible and coinsurance is all reset. So that was Part A. Now let's go over Part B changes for 2021. Now Medicare Part B covers outpatient services, physician services, medications administered in an outpatient clinic. What changed in 2021? Part B premium for 2021 is $148.50 per month for the base beneficiary. Now if you make more than this table chart here, you'll see your premium does change, and it is higher of course than last year. The deductible for Medicare Part B also went up from $198 in 2020 to $203. That's up $5 from last year. Now fortunately, it was predicted that the Medicare Part B deductible would go up to something like $210, but because of the legislation that passed, they actually were able to stop or halt any greater Medicare Part B premium and deductible for 2021 due to the coronavirus. Medicare Part C. What changed in Medicare Part C in 2021? Well, the first thing that changed in 2021 for Medicare Part C is they're allowing now individuals who have end-stage renal disease, that's kidney failure and those who are awaiting kidney transplant, to join a Medicare Advantage plan. Typically in the past, you would not be able to join or switch Medicare Advantage plans if you had end-stage renal disease, which unfortunately had a lot of beneficiaries stuck on the original Medicare program. Alright, so what changed in 2021 for Medicare Part D? Well, a lot did. The first thing that changed, though, isn't that great, and they raised the deductible from $435 to $445. So your deductible went up by about $10. And not all Medicare Part D plans have a deductible. Some Medicare Part D plans that are integrated with Part C plans have a much lesser deductible. It is really up to the plan that you join. So really look into that deductible before you join. They also increased what's called the true out-of-pocket costs for medications to $6,550. This amount pretty much determines how long you'll be in that donut hole of Medicare. For more information about Part D, you can go and check the video here on how Part D works. But once you've passed into that catastrophic phase after the donut hole, you'll have to pay $3.70 for generics and about $9.20 for brand names, or 5%, whichever is higher. Also for Part D, the Insulin Savers program was introduced, and this pretty much levels out the cost of insulin for those members in those plans. Now, when you shop for a Medicare plan, if you are on insulin, make sure you use the Medicare.gov plan finder to identify the plans that have the program in it. If you need help with that, you can go check the video I made here on how to do that. Also, that could save you hundreds, if not thousands of dollars per year, so please make sure that you're in the right drug plan. Now, I know we can't change in 2021 until we have what's called a annual election period or a special enrollment period, but do keep in mind for next year and the years following, if you get insulin or start insulin, because that will save you a ton of money. Medigap plans or Medicare supplement plans, what changed in 2021? Well, luckily not much. Now, we all know that MACRA passed in January of 2020, and that's where Plan C and Plan F were no longer going to be available for those folks who are eligible for Medicare after January 1st, 2020. And that remains the same. The only thing that really changes on the high deductible portions of those plans, Plan F and Plan G, the high deductible version that is, the deductible went up this year to $2,370 as their deductible. Now what that means is if you join a high deductible F or high deductible Plan G, your deductible before the plan pays for anything is $2,370. High deductible plans are not really my favorite. I don't really have a video on it, but if you do some research, you can see that if you join a high deductible plan over like a regular plan or a Plan N, you're actually spending a lot more money. High deductible plans for me are for like a placeholder if you might live in New York, where you can change plans as long as you're part of a plan, and you're kind of just paying the high G until something bad happens and you need to switch plan into a regular F or a regular G. Only in those really specific niche situations would you need to ever get a high deductible plan. What are some other changes in 2021? Well, for the important part is that COVID testing, diagnosis, and services are going to be covered by Medicare at 100%. Also, all Medicare Part D and C plans that have a Part D plan integrated in it have to offer the COVID vaccine at no cost. Medicare also has expanded and continued to put in place telehealth services for their beneficiaries to get care without going out into the community. And one of the most important things that Medicare did pass is the waiver for the 3-day inpatient hospital admission to qualify for skilled nursing home care. Now, if you watch my video on how to qualify for skilled nursing, I did mention that you have to have a 3-day stay in a hospital before Medicare will approve skilled nursing care. So even though your Medicare base costs went up, you won't have to pay any additional costs for COVID-19. So that does add a little bit of protection to your wallet and your pocketbook when it comes to medical costs in 2021.